another important stage. We have to cut it, especially one tooth doctors prep it. I don't want to get interfere. Before we pull up the model, just take it out so that we can see the margin correctly, right? It's very important moment, especially, okay, the other side. And then I cut like this. Yes. All right, it's now ready to pull up the model. All right. This is another one, for example. All right, just make sure this. Take it out. All right. Okay. Take it out. Cool. Now I have the soft tissue. I have to cut it with the separator. A certain distance. Just like this. Okay, especially on other single cloud, you don't want to press it. Okay, to make sure the margin is level. Right, just be careful not too much shaking. Same thing, spray. Cleanse the error, then we can put it in the spot, the oven. So it's just a couple minutes, 5 minutes, something like that. All right, cool. Implant case has a lot of whitish color here compared to 1M1. Probably 1M1 is only here. So after I evaluated, and this is the implant case, so we can make this the contour, which is now I can concentrate this. Okay, so this is 2 units, 1 implant, also 1 crown, and then I can make a little bit more translucency between here and a little bit white calcification. So little 1M1 between OM3 I have to apply together, which is translucency, and then here is the stain, and then I have to make this the contour design about the 2 teeth, right? And then trying to make this better symmetry compared to what patients had. Now we can work with the 2 teeth is 1 implant, which is your cornea and the LC, and we receive the broke, so we make the impression to get the occlusion as well. Okay, now start it. So ready to build up 2 units. 1 is implant, but it's very imperative the frame design. Depends on your frame design, then how much you added, what kind of denting, what kind of enamel you apply for. Okay, let's make sure that one's first. And then after setup, then I add with dentine the top of that. I just add a little bit here. Still dentine apply just a little bit. And then I'm going to cut back with the proper enamel. So this is a proper incisor 8. Put the facial contour. Just little comebacks here. Oh, it's pretty good contour, so I can cut it facially. This. Okay. Let's cut a little bit more because it already has a low value. Okay, so cut whenever I cut. Using the brush. Right. Make sure the same size compared to other. Okay, just add a little bit of our facial here. Now I'm targeting the incisor 1/3. Should have some opolucency. Okay. Then I apply the opolucency. Enamel 03. Okay. Then here, same amount. Okay. So regarding the mamelon, I can do with the stain. This is too much, okay? But I can take it off just a little bit. Alright, that much what I need. Okay, don't want it too much. And then apply the CLF to top because for my frame and the final work. Yes, you don't have to make the all the way down. I'm going to using the more enamel, bright enamel, which is 58. Okay, so this one. This here. Okay, so this area, just put the slightly denting, and then also I apply this setup. Okay, so it's good. Whenever you change it, it's here, same thing. I do setup because my framework is a really good support all the way inside here. Okay. Then I check the occlusion, which is I already checked, so this is a proper linger. And then I'm going to add about 58, and then the finish mop, the build up. Okay. After I check the bottom counter, I have to decrease the engraving. By the way, this is a really good color. This is a bigger. No problem. A little tighter. A little bit. Oh, okay. So here. Very high. Like a little bit my approximate contact is long, no black triangle, but I have to grind it a little bit. Yes. Now we're getting there. See? Okay. Same thing, I can cut it just to round it, just to make it round. Anyway, this is all this one. After I finish my video, I can finish more better. But like I said, follow there. Okay. That's good. Okay, spinner. I just want to show you what it look like with the stain. Okay, so I like it's good emergence profile from here, lateral. So whenever I see the analysis, the lateral is really tucked in compared to the other side, but I have to make same maintains with the height of contour between 8 and 9. Okay, now to finish. If I have to stain, very subtle, like I said. Subtle gingiva area. Alright. This is already stained before, so which is great. And then you can use the a little bit more impact if you want to. See? Okay. Now I want to utilize a little bit more whitish, which is I saw the photo. Just little tint. Like this. Okay, which is patient has it. Same as here too. You don't have to make duplicate exactly, but try to make it. Alright, so that's the final. So after I videotape, I'm going to do a little bit more concentrated and then stain as well. Okay, so then we finished the 2-unit custom implant cases. Okay, this is finals. Basically it's 1M1, but they created the highest aesthetic as much as possible. So here is the 1M1 color. Here is the custom, the restorations. Okay, the enamel tool. Now that one is the zirconia implant. Okay, just make sure the interproximal contact. Okay. Right.